Hello everyone, welcome to Patho Excellence. Let's see cloudy and hydropic change in kidney under the microscope. So what is cloudy change? Cloudy change or cloudy swelling, it is the cell swelling due to accumulation of water inside the cytoplasm. Hydropic change and cloudy change is seen in renal tubules, mainly in the proximal tubules, whereas ballooning degeneration, which is seen in the liver, and this is due to distended cisternae of endoplasmic reticulum. So whenever we see slide, we have to start microscopy with the scanner view or 4x objective. So here we can see this is the outer portion or capsule of the kidney. This portion is the cortex, and if we move towards medulla, so this is medulla. Now how to differentiate medulla from the cortex? So cortex is basically comprising of many glomeruli and many renal tubules along with the vasculature, whereas medulla is comprising mainly of renal tubules collecting dirt and vasculature. There is no glomeruli in the medulla. Now let's see hydropic change in the renal tubule. So here in 10x view, we can easily appreciate there are many tubules which are having clear looking appearance, and this is due to accumulation of water inside the cytoplasm. Now there are two types of tubules, proximal tubules and distal convoluted tubules. So how to differentiate proximal convoluted tubules from the distal convoluted tubules? So proximal convoluted tubules are having abundant eosinophilic cytoplasm due to increased number of mitochondria, whereas distal convoluted tubules having less eosinophilic cytoplasm, and proximal convoluted tubule having brush border due to microvilli, whereas distal convoluted tubule comprising of cuboidal epithelium with increased number of nuclei and very little amount of or less eosinophilic cytoplasm. So this is distal convoluted tubule and this is proximal convoluted tubule. Here you can see, compare, if this both the tubule, this is having granular eosinophilic cytoplasm and number of nuclei are less compared to DCT. So these are the difference between PCT and DCT. So this is how you can appreciate this. And this cellular injury or cloudy change is most prominently seen in the proximal tubule. So this proximal tubule, you can see there is vacuolar change in the cytoplasm. So vacuoles are easily identifiable and lumen is having cloudy change. There is loss of microvilli, and here this is the DCT, which is very less affected by this cloudy change. So abundant pink cytoplasm is giving appearance of cloudy change, and in hydropic change, see, this is hydropic change where there is clear vacuoles in the cytoplasm of the tubules. So this is how you can appreciate cloudy change and vacuolar change in proximal convoluted tubules. And this injury is reversible because here you can see these nuclei are normal in appearance. So nuclei are not damaged. So if injury is stopped, then these cells can be revived and injury is reversible. So that is how you can identify cloudy and hydropic change under the microscope in the kidney section.